Hello everyone, this is Dr. Prem Kumar again, consultant medical oncologist as well as a radiation oncologist. And this month, November being GI tract awareness month, so I thought I'll brief you guys about pancreatic cancer, which is over the recent times it's been on the rise. Pancreatic cancer is quite rare, but it's on the rise nowadays. And as you all know, any cancer, age is the biggest risk factor. As we all age, cancer becomes a big looming risk. And as far as pancreatic cancer is concerned, alcohol. So it's mostly predominantly found in men. That's because alcohol is one of the main risk factors in pancreatic cancer. Like you take too much of alcohol and the pancreas becomes chronically inflamed, which is called chronic pancreatitis, and this chronic pancreatitis over time can turn into a pancreatic cancer. Now, this is the main risk factor, but then you do have genetic risk factors as well. For example, a person who's got a particular mutation in his chromosome, his or her chromosome, for that particular cancer clone, can have a cancer later on in his or her life, provided the alcohol also comes into play. So both the internal as well as the external factors, they merge together, and that's when the cancer gets projected. Until then, not. So how do you recognize this pancreatic cancer? Like most often than not, any cancers, including pancreatic cancers, by the time the patient feels the symptoms and he seeks medical attention, it might be advanced, a little too advanced or much advanced as well, but still under the purview of treatment though. So pancreas, as we all know, produces digestive enzymes, so which means it's related to digestion. So any problems with your digestive system like indigestion, we call it dyspepsia, burping, vomiting, abdominal pain, for a consistent period of time, and which is not responding to our regular treatment. Normally you go to your family doctor and the doctor gives you a set of pills or an injections or a couple of things, and it gets over, and you're much better, you feel much better in a couple of days, and then that's about it. And then again, maybe in another 1 week or so, you get the same kind of symptoms. So you go to the same doctor, or you might start doctor shopping, go to a different doctor. So this goes on. But then after all this, if the same symptoms persist and last for more than 2 or 3 months, unrelenting to whatever treatment you get, then you need to be alerted. You need to be very alert as to something really might be wrong, and so you need to get investigated. So then you need to tell your family physician about this, discuss about this, and he or she might refer you to a specialist, a gastrointestinal specialist, who might in turn do certain investigations. Like nowadays you all must be aware of CT scans, and there are tumor markers. Like for example, tumor markers is a simple blood test where we just draw some blood sample and we test a particular marker for that particular cancer. For example, there is a tumor marker called CA 19.9, which is very specific for pancreatic cancers, along with other markers like CEA, which is a carcinoembryonic antigen. These are simple blood tests. Of course, this can be combined with CT scans, which will give you an anatomical picture of the pancreas. And nowadays we have the very advanced PET CT scan also, where the PET scan is merged with CT scan. So you not only get an anatomical picture, but you also get a metabolic activity. So any high metabolic activity is indicative of cancer. So in that instance, when your doctor gets alerted, he or she might take a biopsy, a tissue diagnosis from the suspected area, and then which would actually confirm the presence of a cancer. Now cancer, if it is diagnosed at an early stage, which is very rare, as I told you, because in an early stage, symptoms are very less. The patient will not get any symptoms, so there is no need for the patient to seek medical advice. Whereas in an advanced stage, that's when the symptoms pop up, and that's when the patient comes to the doctor. Now, so you've diagnosed the cancer, now your doctor needs to treat you. Now, is this curable or not curable? Early stage, definitely curable. Late stages, it is still curable. Very late stages, of course, advanced, where it spreads through the blood to lungs, liver or bones, distant organs, then it's not curable. That is called metastatic stage, where still palliation can be very much possible. Palliation in the sense just controlling the symptoms like pain, abdominal discomfort or whatever emanates from the main cancer. That's because you control the symptoms, you give the patient a very good quality or a reasonably good quality of life, which is very important. So, early stage and slightly advanced, locally advanced stage still curable by way of surgery, and after the surgery we look at the pathological features and decide whether the patient needs further therapy like radiation and chemotherapy. If not, surgery alone might suffice depending on the stage, and depending on the pathological features. So, that is curable. Surgery we have, and we have radiation, we have chemotherapy. When it comes to the advanced stage, as I said, metastatic, which is not curable, only palliation is possible. Still, we look at certain markers, and if those markers are expressed by the tumor, we give targeted therapy. So, targeted therapies along with chemotherapy play a very vital role in an advanced disease stage. So, still, even though we are not going to cure, we are going to effectively palliate the symptoms and keep the symptoms under control and give a reasonably good quality of life to the patient. So, he or she can take care of his or her activities by themselves. That is very important. So, we know how to diagnose cancer, to pick up the symptoms, what kind of symptoms and signs you need to be alert of, and when to seek advice from your doctor, and what all technological advancements by way of diagnosis we have nowadays, and also the treatment modalities. So, but all this said and done, you need to have a very healthy lifestyle free of alcohol, good physical activity, exercise, and avoid obesity, and take care of other comorbid illnesses like diabetes and hypertension and heart disease. Everything needs to be addressed. So, it is a holistic approach that we are really looking at. So, folks, I think I will conclude here. So, be aware and take care.